So, hello everyone. I hope every one of you is doing excellent, revising, solving more and more questions, and is more and more near to their dream branch or dream college. So, the exam is going to be on 3rd of August, and from now, that is from 20th of July, at least around 14 days are left. But I have made the plan from tomorrow, that is 21st, for the 13 days. I have divided the entire strategy into 10 plus 3 aspect, and then I'm going to discuss about all those frequently asked questions that you asked me in these recent times, and I'm going to address all of them along with the strategy. So I guess without wasting much time, we should get started. So let's start up with the plan that I have made. Before that, I'm going to give you some of the pointers that you have to keep in your mind before going and starting up for the preparation. So now you can easily see on your screens, these 13 days are going to be the changer for you if you are going to follow all these points that I have told you. So first and foremost, we have to divide entire thing in 10 plus 3 days. The last 3 days are going to be subjective. What do you mean by subjective? Ye last ke 3 days are those where you are going to cover all those volatile topics, the image based topics, everything. I will tell you the last 3 days strategy first actually. So in the last 3 days you are going to cover extremely volatile stuffs. Apart from that, all those images for which you would have taken screenshot, I believe that till now you have started all those taking the images screenshot or saving them as the bookmarks. So you have to revise them at the last day. Along with that, the new updates or the drugs, for example, there is recent new drugs have been launched for any of the cancer or the BNS you want to read. So you have to read it on the 2nd August, and I will suggest evening when you are done with everything, then you just go from this. Very important, you have to flip the choti copy. Flip the choti copy. I think you would have made the choti copy. If not the choti copy, so the topics you have to just flip over that. What is that known as? This is what we always talk about, the passive recall. Now I'm not going to talk about the active recall again and again. The active recall thing would have been done till now. From here onwards, the passive recall thing has to be started. Also, the another pointer I would like to tell you here itself is yahan ke baad, rather than focusing more on questions, you have to focus more on revision. Do not build any new concept. I'm telling you again, do not build any new concept. Just the old concepts with the same revision pattern, with some of the MCQs, but those MCQs should not be PYQs. I will tell you why. Apart from that, what you are going to do in the last 3 days is any rapid course can be done. So in the rapid course, usually in the YouTube, there is LRR, or the other faculties will have 3 hours entire subject they will be completing. Or in BTR, if you're following, so ma'am has covered mega NEET BTR. She will be bringing mega NEET BTR in the last final days. You can go and approach to that video. That is going to help you a lot. So last में क्या समझ आता है? You are training yourself in the last 3 days for those 3.5 hours. So you have to think more strategically, you have to think more practically. यहाँ पे concepts काम नहीं आएंगे. When you are sitting in the 3.5 hours, you should be very tuck that all those things, all those books, all those pages should be opening in your mind, and you should be able to mark that one answer out of those 4 options. That is what you are training from now, and then emphasizing more on these 3 days for the exam. Now, next, talking about the other important things that I would like to suggest you. From here, I would tell you that you have to give only one, or you should not give any GT at all. Because GTs during this time, I have seen this with me and with my friends also. If you get more marks, you are going to overestimate your rank. If you are getting less marks, you are going to underestimate yourselves. And also, please remember, ऐसा नहीं होता है that final GT में जो marks आएंगे, that will be simulating the real exam marks. I have seen many people who were getting 130 and they finally scored around 165, and many people who were scoring 165 or 170, they came back to 140 or 150. So do not judge yourself on the basis of GT. This final GT will be okay, ये मेरे weak subjects है, ये मेरे strong subjects है. On this basis, how I am going to approach even during the main exam. मुझे इस subject मेरा anatomy weak है, तो इसका मतलब during the main exam मुझे anatomy वाले questions में उतना ही टाइम लगाना है जितना मेरा ब्रेन समझ सकता है. ओवर थिंकिंग, इलोंगेशन, एक्स्ट्रापोलेशन ऑफ थिंकिंग नहीं करनी है. सिमिलरली, अगर जीटी के टाइम पे मेरा स्ट्रॉन्ग सब्जेक्ट साइकी, डर्मा या फिर मेडिसिन जा रहा है, इट मींस आई एम वेरी श्योर आई डोंट हैव टू हैव द डबल गेस व्हेन आई एम डूइंग द क्वेश्चन. आई शुड नॉट मार्क द डबल गेस. दैट इज व्हाट इज द इंपॉर्टेंस ऑफ द फाइनल जीटी. यू हैव टू रजिस्टर दिस इन योर माइंड. Third important thing, as I told, do not solve PYQ, because it is going to have this PYQ bias. Apart from all the Niemann, Pygmalion, all these biases, there's a new bias which is known as PYQ bias. I will tell you why. So it happened with this time also. Many of my friends and many of us, when we talked, so they told me that recently when there was INSET exam, there were many questions which were which were framed in the same way as the previous questions, but the options were changed and they marked that previous option. because they would have solved that question, and this bias will be there till the last time. जब आप question screen पे देखोगे, अरे भाई ये तो मैंने किया, and then C option mark कर दिया, because C तो रटा हुआ है ना memory में, लेकिन at last it will come to be any other answer. So you have to be aware about that. Okay, so how are you going to remove this bias? No blinding, nothing. You have to do the clinical set questions. Clinical set questions, mixed bag question, at least 50 to 100 questions daily you should solve at this point of time. After this, there comes the importance of passive recall. See, abhi tak you would have had the active recall, abhi tak brain ko jitna train karna tha done. Now whatever, like when we make a house, right, hum plaster karte hain, cement lagate hain, and then we start putting the water in there. That's what is you have to do in these last final 10 to 13 days. You have to just supplement that same information with again and again, again and again, again and again. That is what is known as long-term potentiation also. Okay? So in that way, you have to do the passive recall. Okay, so passive recall at this point of time is very important. Now, I will tell you the most important thing that now NEET PG is actually loving to ask. It is loving to ask about the image-based questions. If you see, last time there were 2 NEET PG shifts. Okay, 400 questions in total. Out of these 400 questions, around, I'm telling you, around 120 to 140 questions or even more than that were just image based, और उसमें से भी radiology की कम से कम 30 to 40 questions थे. So you have to shift to these image based question along with the radiology questions. At least you have to do this 50 to 100 daily. Okay, next, talking about the 3 subject strategy. What is that 3 subject strategy? During these last 10 days, what you have to divide in your day is into 3 main important aspects, where the initial will be the major subject you will be covering, the intermediate subject you will be covering, and the minor subject you will be covering in one day only. तो अभी at this point of time 19 subject है आपके पास. 19 में से भी medicine जो है वो सबका integration है. So let's come back to 18 itself. Okay, 18 subjects है. Now you are having 10 main days. How you are going to divide this? 3-day strategy. I'm going to tell you. You are going to thank me later. This 3-day strategy worked with me and with many of my friends. So I guess it is going to work with you too. Now after this, प्लीज रिमेंबर, टिल नाउ आई एक्सपेक्ट दैट आप सभी ने अपने सब्जेक्ट्स के ग्रे सब्जेक्ट्स में भी ग्रे टॉपिक सेलेक्ट कर दिए हैं. उन ग्रे टॉपिक्स में से नाउ यू हैव टू सेलेक्ट द टॉपिक्स and you have to prioritize them. I will give you an example. So for example, in suppose in pharma you are getting problems with the antimicrobial parts. I want you to read antimicrobials first. If you are having problem in obs gynae in the preeclampsia aspect, you read preeclampsia first. Similarly in surgery, if you have problem in the hepatobiliary system, read that first. Why? Because now you have to prioritize those things which were your weak but not so weak subjects, where you can have some, if you push some more, you are going to get a good grip and good marks over those questions from those selected topics. So at this point of time आपका main purpose ये होना चाहिए कि prioritization सीखना है. Suppose RR में या BTR में ma'am has taught surgery and it goes in general trauma and all these things. If it is going, you don't have to go in that same flow. अभी तक जो पढ़ा है वो हो गया. Now prioritize. भाई मेरा hepatobiliary system खराब है, I will do that first. Once I'm done, then उससे कम कौन सा है, उससे कम कौन सा है, जो सबसे अच्छा है उसे लास्ट में करो. Because I told you, you would have polished all your strong items, strong subjects. तो इस point of time में अगर वो नहीं भी होता है, वो it is fine. You just have to flip the pages. That's it. But you have to prioritize those where you are getting less marks or you are making silly errors. Okay, that's what I mean by the prioritization. Next, you have to focus on the intermediate and the strong subjects more. See, if your weak subject is anatomy, you don't have to run behind anatomy कि भाई अभी मैं 3 दिन लगा के anatomy सब कुछ clear कर दूंगा या कर दूंगी. It will not happen. If it has been your weaker subject, it is your weaker subject. I am not demotivating you, but I am being practical at this point of time. Rather, practicalizing that एक दो subject जो weak है उससे better है उन पे ध्यान दो, which are your very strong subjects. It happened with me. For me, PSM was never a very good subject. So what I did, I tried to polish up my other rest of the subjects, especially the short subjects that gave me the grip in INSET. And I want you all to have a grip over these short subjects, because these are straightforward questions and they are going to give you direct marks. So that's what I mean by intermediate and strong subjects more and more focusing and polishing. And if you are having some of the 3 to 4 weak subjects, I don't want you to leave them. Rather, you have to solve at least the PYQs or look into the PYTs of these subjects. For at least for last 3 to 4 years, you can go for the PYQ solving. But again, remember, with a caution, there should be no PYQ bias. Next, 70-30 strategy. अभी तक मैं क्या बोलता हूँ, हमेशा I used to say that you have to solve more questions, but now I'm going against this. You have to have to solve around 30% of the questions in a day and 70% should be given into your revision. That revision can be divided into two parts. One revision will be when you are having this passive recall, and the another revision will be the one which you are going to see your bookmarks and all your selected or the saved images. Okay, next, do not test yourself on the basis of GT marks, that I have already told you, and दूसरों के GT marks के basis पे भी नहीं सोचना है. Another person is getting 199, I'm just getting 119, it's fine. You are destined for one seat. That 199% is destined for one seat. ऐसा नहीं है कि सीट्स बहुत कम है. अपने अंदर के एंटिसिपेशन को हटाओ कि एग्जाम डे के दिन क्या होगा, मेरी रैंक आएगी या नहीं, मेरा स्कोर होगा या नहीं. ड्यू टू दिस देन यू विल बी इनटू अ लूप ऑफ स्लीपलेसनेस आल्सो, एंड दैट इज गोइंग टू रूइन एंटायर मेहनत. आपकी मेहनत खराब हो जाएगी. Next, one of the very important thing, this is some of the environmental factor that is going to play a role in your preparation, that is 15 to 20% minute of the meditation or the walk is going to help you. हम इतना burnt out हो जाते हैं and we actually try to disconnect. We need not to disconnect. ठीक है, वी नीड नॉट टू डिस्कनेक्ट फ्रॉम द आउटर वर्ल्ड कि नो 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 मैं अपने अंदर बैठ के रूम में बैठ के आई विल डू द वंडर्स. या डेफिनेटली यू विल डू, बट एट द सेम टाइम you want, your brain wants relaxation. You have to go for at least 15 to 20 minutes meditation and yoga or exercise. This is going to help you a lot. Apart from that, there is no need to disconnect, but yeah, definitely you have to stay away from the negativity. That negativity would be arising in the form of comparison from your parents, maybe from your relatives, maybe from your girlfriend, boyfriend, maybe from your friends, from anyone. You have to be stay away from that. This is एक चीज जहां पे आपको स्ट्रांग रहना है. आई वॉन्ट ऑल ऑफ यू टू बी स्टेइंग अवे फ्रॉम ऑल दीज नेगेटिविटी एंड स्टे स्ट्रांग एंड स्टे पॉजिटिव टिल 3rd of August 12:31 PM. उसके बाद आपको जो करना है आप करो, एंड देन वी विल सी द रिजल्ट्स. डेली फार्मा एंड पीएसएम 30 मिनट्स इट इज गोइंग टू हेल्प यू अलॉट. डेली फार्मा के आप कर लो. आज सीवीएस के कम से कम सीवीएस के 3-4 मेन टॉपिक्स के ड्रग्स देख लो. दैट इज गोइंग टू हेल्प यू. Similarly, TND from any of the platform will be a great help for every one of you, be it DAMS, Bhatia, Cerebellum or the Marrow Delta MCQs. It is going to help you a lot. You should know the art of ruling out. Apart from that, you have to start regularizing your schedule. You can't be like last day, अभी तक तो मैं 1-1:30 बजे सो रहा हूँ और लास्ट के दिन तो मैं 11:30 सो जाऊंगा. ऐसा नहीं होगा. ब्रेन उस समय तक ट्रेन हो चुका है. You have trained your brain. From today only you have to start decreasing that thing कि ठीक है मैं 1:30 बजे सो रहा हूँ, मुझे उस दिन 11:30 पे सोना है. मैं अब धीरे धीरे 1:15, 1:12 इस तरीके से वापस आऊंगा. That's how you are training your brain. And at last I tell you what, everyone have read everything, but at last only those people are going to win. Only those people are going to have the grip over all of you who have that 3.5 hours का presence of mind. And presence of mind तभी होगा जब mind train होगा उस दिन के लिए. So right now for the last 13 days you have to train your brain. Please remember this logo or the top please remember this quote that you have to train your brain. Are you getting that? Next, start regularizing your schedule. Stop comparing. Stop taking unnecessary drugs. So many people are so many of the people are messaging me, sir, can I take clonazepam, can I take zolpidem, can I take melatonin? No, you can't take only for one of the things. ये सबको होता है exam anxiety. अगर कुछ excess में हो रहा, go seek the help of a psychiatrist. Please do not start medication on yourself. I know every one of us is an MBBS doctor, but at least these drugs are not very safe to directly start. What would happen अगर आज आपने लिया and then you think okay आज तो मैं खुश हो गया, last के दिन you are taking it and you're not you're having all those sedation and dizziness. That's not good for you only. That's why I am saying that you go and seek the help of a psychiatrist when you have all these problems rather than directly starting these unnecessary drugs. And then stop anticipating, guys. Stop anticipating. See, you have to go and win one seat. There are so many seats. So please stop anticipating. These are all the frequently asked questions that I have summarized on the basis of the points. Now, let's look up into the strategy. So now let's talk about the strategy for the initial 10 days, that is from 21st July to 30th of July. Please remember you have to divide your day in 3 subjects. What I have done, I have tried to make a this timetable for all of you. You can take the screenshot here by pausing the video and you can take the screenshot. So what I have done, major subject, intermediate and short, इस तरीके से मैंने सारे के सारे 19 subjects को cover करवाया है. So I will just give you a rough example, okay? पहले मैंने 2 दिन मेजर सब्जेक्ट पीएसएम करने हैं, 2 दिन मैंने इंटरमीडिएट को डाला है, बट शॉर्ट एक दिन में खत्म होना है. डर्मा एंड साइक, यू हैव 24 आवर्स. 24 आवर्स में से अगर आप 12 आवर्स भी पढ़ते हो और 12 आवर्स का डिवीजन अगर आप इस तरीके से करो, यू कैन गिव अराउंड 6 आवर्स टू द मेजर सब्जेक्ट, देन रेस्ट ऑफ द 4 आवर्स टू द इंटरमीडिएट, एंड देन द शॉर्ट सब्जेक्ट कैन बी गिवन 2 आवर्स इफ यू आर रीडिंग फॉर 12 आवर्स. सिमिलरली यू कैन डिसाइड ऑन योरसेल्फ, बट आई वांट टू कवर एटलीस्ट दीज 3 सब्जेक्ट्स इन वन डे ओनली. अब शॉर्ट सब्जेक्ट आते आते आपके पास जान नहीं बची. प्लीज फ्लिप द पेजेस. प्लीज फ्लिप द पेजेस. प्लीज do not read line by line, it is not going to help you, trust me, saying from the experiences. ठीक है, क्वेश्चन कर लो, अगर ऐसा लग रहा है डरमा के सिर्फ इमेजेस देख लो, शॉर्ट सब्जेक्ट अगर नहीं हो पा रहा है, 1 घंटा बचा है, सोने वाले हो, इसीलिए you just have to go and watch the image based questions, or you just see the bookmarks that you have done. Similarly, what I have tried to do here is मेजर सब्जेक्ट को 2 दिन देके, इंटरमीडिएट को 2 दिन देके, और 2 दिन में 2 शॉर्ट सब्जेक्ट, इस तरीके से आप 2 days में 4 subjects complete karo. That's what should be our main motto at this point of time. That is how I have tried to make the strategy for the 10 days. You can take the screenshot. Next, last 3 days I have already told. Now coming to the strategy on the basis of the GT scores. GT scores में those people who are already scoring 150 plus follow everything that I have told इससे पहले in the form of all those pointers. Less than 100s आ रहे हैं तो short subjects, PYQs, you don't have to skip any of the important topic or the subject at this point of time, and you have to think practically. Think like an intern. Intern क्या करेगा? Do not say call for help. अगर कोई emergency आती है, what is the first thing you are doing? अगर any person with the chest pain is coming, along with that he or she is sweating, पूरा radiation आपके left side of the forearm and arm की तरफ जा रहा है, what is the first thing you will be doing? What are the investigation? What are you going to do? That is what you have to apply at that point of time. And short subjects को priority देना शुरू करो. At this point of time 10 days हैं, 10 days में 10 शॉर्ट सब्जेक्ट्स ऐसे निपटाओ कि उसके क्वेश्चंस गलत नहीं होने चाहिए. Now talking about those who are between 130 to 150 and 100 to 130, I've tried to prepare a table. It's actually, I feel that these both of the ranges are somewhat same. थोड़ा सा difference है that what I have experienced. So when you are 130 to 150, please remember you have to refine more and more volatile subjects. You have to shift to the smart question based revision. You have to focus on the high yield clinical MCQs. From any of the platform you can go and start solving the MCQs. 70% revision should be done with the high yield topics, and 30% should be the active recall. That's what I always say, active recall kam karo. Revise with integrated topics, and just remember you are almost there. Don't burn out now, because you have to stay calm and revise as much as you can, because ये वाला 130 to 150 कब 150 plus चला जाएगा, you will not know. Talking about 100 to 130, and you feel that now you are in a plateau phase, you have to strengthen the core concepts in the 10 major subjects. जो ऊपर के total 10 आ रहे हैं, that includes the strong and intermediate, उन सबको आपको strong करना है. आपको questions के basis पे learn करना है. If you feel that okay, I don't know something about G6PD deficiency, you see the question, there will be the explanation, then from that explanation you have to then go and learn the topic. 60% revision and 40% test. Again, in these people you have to go for more and more recall based approach, okay, and prioritize the volatile subjects along with the scoring subjects, like I always say, path, pharma, microbiochem and PSM. Please remember, you don't have to do any of the self doubt at this point of time. I know आप burnt out हो चुके हो, but just remember guys, it's just the matter of next 2 weeks. I hope that इससे पीछे shift ना हो, but अभी तक 3rd August है, you don't have to worry a lot. You are very near to what you wanted, and now go and achieve it. That's it. Keep studying. All the best. Bye bye.